This is going to be a different school year. It's important to talk about those differences in advance to make sure that your children have an understanding regardless of their age. It is important that everyone in their local communities comply with their local school's guidelines. The big question parents have right now is how their kids can return back to school safely during the current COVID-19 pandemic. While it feels as if summer has just begun in some parts of the country, many states are gearing up for a new school year that will start before we even know it. After a spring semester of remote learning amid the COVID-19 spread, sending our little ones back to school, whether they're heading to preschool or high school, seems daunting. I'm on the front lines of this pandemic treating COVID-19 patients every day, getting a better understanding of this virus. While it may not be ideal, if your community is returning back to in-person learning, I'm here today to share with you the best way parents and educators can prepare to take their classrooms off of Zoom and return for a safe and healthy school year. Hey everyone, I'm Dr. Jordan Wagner. I'm a board-certified emergency medicine physician, and on my show, I answer your urgent medical questions and clear up myths about certain deadly diseases. If you haven't already done so, please make sure you hit the subscribe button and turn your bell notifications on. That way you're instantly alerted when I post a new video. There's been a lot of controversy surrounding whether schools should open or not around the United States. Local school officials and public health experts have been working together to decide how and when to reopen schools. These decisions will take into account the spread of COVID-19 in their local community, as well as whether schools are able to adhere to CDC guidelines for making in-person classrooms safe again. Schools and families should also be prepared to return to virtual classrooms if coronavirus cases start to increase in your local community. First, let's understand the protocol adjustments many education institutions are implementing to ensure a safe and healthy return. Limiting physical interaction between students and educators has been one of the biggest focuses for schools. Number one, some schools will be having teachers move between classrooms rather than having students fill the hallways during passing periods. For those schools that are having students pass in between periods, it's encouraged that they mark their hallways and stairs with one-way arrows on the floor to cut down on crowding in the hallways. Number two, the days of eating in crowded cafeterias might be behind us for now. Most schools will be encouraging students to eat their lunch in their classroom, at their desk, 6 feet distance of course, or outside in small friend groups. Number three, schools will also be encouraging school faculty and staff to leave classroom doors open to help reduce high-touch surfaces such as doorknobs, and to leave their classroom windows open to promote fresh air circulation. And of course, everybody in the building will be wearing a face covering. Number four, it's encouraged that students avoid taking the school bus if possible. However, those students who will be riding the school bus this year, the school should be assigning seats and of course, requiring them to wear a face covering while on the bus. As important as it is for students and teachers to work diligently for a safe return to classrooms, you as a parent play just as important role in ensuring a safe return to the classroom this year as educators and health officials do. Don't send kids to school sick. I hate that I have to say this, but please don't send any child who is symptomatic of any illness to school. Keep a thermometer on hand at home and regularly check your child's temperature before sending them off to school. If your child does have a fever, do not just give them medication and send them off to school. Contact your pediatrician immediately and identify with them the appropriate steps to take. Bring your own school supplies. Ensure you're sending your child off to school with their own markers, pencils, and notebooks. The days of communal crayon and marker boxes have come to an end for now. Back to school shopping can sometimes put a financial strain on families, especially in the age of a pandemic. If purchasing school supplies isn't really in the budget this year, I encourage you to reach out to your child's teacher or local school district and inquire about school supply assistance programs. Most communities do offer them. Pack hand sanitizer. Kids should be toting around 60% or higher alcohol-based hand sanitizer, which kills most types of bacteria and viruses. Not only does carrying around hand sanitizer avoid washing hands in a communal bathroom, but also your child will be prepared if taking the bus or right before lunch. If you have young ones, I encourage you to practice these habits at home and make using hand sanitizer a routine with your child. A lot of portable hand sanitizers come in all shapes, smells, and sizes that often appeal to younger children. Remember to supervise young children when they use hand sanitizer to prevent swallowing the alcohol. Have a supply of masks on hand. Students should have at least 1 or 2 spare masks on them daily in case their mask breaks or gets dirty. Children imitate their parents' behavior. Just like practicing incorporating hand sanitizers into your household, practice wearing face masks now before the school year begins. If a child spends 0 time right now wearing a face covering, then students will have a hard time spending hours wearing them when school's back in session. Parents should build a routine of wearing a face covering with their children at home. Keeping your household safe by having a back from school protocol, just like I have a back from the hospital protocol. Something to really take into consideration as students head back to school is keeping your home as clean as possible, which includes disinfecting kids when they get home. But don't spray them, please. When your child returns home from school, they should immediately remove all clothing and place them in the washing machine and sanitize any outside items that might have been brought along with your child to school, such as their backpack. Following up with a shower might be ideal too. In addition to having plans in place to keep your child safe when returning to school this year, there are other factors that you, as a parent, and school communities should keep in mind. The pressure to catch up. Parents and educators should adjust their expectations for their children and meet them where they are academically and mentally, not where they think they should be. Students may not have retained the same level of knowledge from the digital classrooms as they would have in a physical in-person classroom. The impact of schools being closed may have been greater for students with disabilities as well. They may have a difficult time transitioning back to school after missing out on school-based services such as occupational, physical, speech-language therapy, and mental health support counseling. Parents should work with their child's school to assess the needs of their child before they return to school to ensure that the transition is smooth. Stay positive for you and your child. Parents are one of the kids' biggest influences. As I previously mentioned, children naturally act and mirror behaviors and feelings of their parents. It's simply human nature. Parents and school districts should maintain a sense of flexibility and patience with students. We need to recognize that students are going to need some time to reacclimate to school, especially when the adults in their school are wearing masks and the whole environment looks completely different and everything is operating differently. This is going to be a different school year. It's important to talk about those differences in advance to make sure that your children have an understanding regardless of their age. It is important that everyone in their local communities comply with their local school's guidelines. All right, that's been a quick coronavirus conversation with me, Dr. Wagner. Let me know in the comments if you have any other medical questions that you'd like me to answer. And as always, make sure to subscribe and hit that bell notification. Thank you so much for watching. Stay healthy, my friends.